Thank you, Steve. Good afternoon, everybody. I can only see about 5 of you because of the way the Zoom's set up. Let me just change my view so that I can see the gallery. Hang on. How is everybody this afternoon? I can see some very familiar faces, which is great, and some very unfamiliar faces, which is even better. So welcome. I'll get started. I'm going to share my screen while I'm just trying to work out. Oh, there's my PowerPoint slide. Okay. Okay, here we go. Okay, can everybody see my PowerPoint screen? Yeah, nodding. I can now only see again about 3 or 4 of you. And I should say, I won't, because I'm presenting now, I won't be able to see the chat. So as Claire said, note down any questions, any thoughts, and we'll try and kind of scoop them up together at the end. So I'm going to talk about young people's mental health and the impact of the pandemic on young children and young people. So the first thing to say is whenever I refer to the impact of the pandemic on children and young people, I suppose what I'm actually talking about are the measures that have been taken to suppress the virus rather than the virus itself. So things like social distancing, things like school closures and so on. And the fact that obviously that has changed and evolved over the last kind of, about a year and a month. And we'll get into some of that as we move along. So Steve said, I'm his predecessor as the head of MIE. I'm now the Sarah Fielden Chair in Psychology of Education. I've got my email address and my Twitter handle if you're on Twitter and you enjoy lazy memes and retweets, then please do follow me. If you want to get in touch, you can drop me an email. What I wanted to start with was just an acknowledgement of what we've all just been through over the last kind of 3 months, and I'm saying the last 3 months rather than the last 13 months, because my sense has been that this most recent lockdown has been the most difficult. I don't know if that's something that resonates with the rest of you, but as a father, as a academic, as a teacher, this last one has been really, really difficult. And it's felt a little bit like Groundhog Day, which is why I included the little video of Bill Murray. When Groundhog Day came out and I was a teenager, I thought it would be brilliant to live the same day over and over and over again. And then the last 3 months, that's what it's felt like. It's, there's been nowhere to go, not much to do, sitting in front of a computer screen day after day after day. And it's nowhere near as much fun as it's made out in Groundhog Day. But we are now, I think, moving into a very positive position. The weather's improving, the restrictions are being removed gradually. The vaccination program is rolling out at a brilliant pace. It's one of the only things that I would be willing to put my hand up and say the government has done an exceptionally good job on. And things do seem to be getting better. Kids are back in school. So it's, things I think are looking up, and it's important to acknowledge, even though things have been very difficult, things are improving, and a positive outlook, I think, is really important given everything that everybody has been through. So what I'm going to talk about, I'm going to focus on what the research evidence tells us about the impact of the pandemic and like I said, the various virus suppression measures on children and young people's mental health. I'm going to, within that, say a little bit about what we can possibly say about the extent to which the pandemic has kind of reinforced or exacerbated or amplified existing mental health inequalities, and also think about what some of the factors are that appear to underpin variability in children's mental health. So children's mental health has deteriorated over the course of the pandemic. What are the associated factors? And for those children whose mental health has improved, what appear to be the factors that underpin that? I'm going to spend a little bit of time thinking about what schools and colleges might do. And I'm going to talk to you a little bit about our new project, which is a local project again, so it's very fitting for this seminar series. It's the Greater Manchester Children and Young People's Wellbeing Programme. But what I don't want to do is step on the toes of next week's seminar that Ola's leading, or the week after that Alice is leading. So Ola will be talking about the experiences of young people through her excellent teenagers' experiences of life in lockdown study. As a result, what I'm going to mostly focus on is what the kind of quantitative, the large-scale research is telling us, because the qualitative research, Ola is the expert on, and she will deliver a brilliant seminar on that next week. And then similarly, I'm not going to go into too much detail about exactly what strategy schools and colleges might use. I'll talk about it a little bit, but Alice is the person to tell you about that and the brilliant work that's going on in Salford. Okay. So what I want to do first is just to get a sense from you as colleagues in the seminar, what you feel in terms of the impact of the pandemic on children and young people's mental health. So what I'm going to do is I'm going to stop sharing for a second, and I'm going to go to Mentimeter. If you bear with me 1 second, there we go. Okay, can everybody see my Chrome screen? Brilliant. Okay, so I'm just going to go into present mode. So if you have a web browser open, if you would go to menti.com and it'll ask you to put a code in, and the code is 2278952. And it's just a very simple question. Has the COVID-19 pandemic impacted on children and young people's mental health? And you have three choices. You can opt to say there's been no change. You can opt to say that the change has been negative, so it's increased mental health difficulties and reduced well-being. Or you can opt to say that it's a positive impact, that it's reduced mental health difficulties and increased well-being. So I'll just give a minute or two for people to have the chance to vote. So it looks like it's stabilizing now. There's about half of you have voted. Anyone else that wants to vote, please just pop in your response now. But I think the overall pattern, reading the room as it were, is very clear that the overwhelming majority feel that there has been a negative impact of the pandemic on children and young people's mental health, which is exactly what I expected to see. So thank you for your participation. I'm just going to briefly unshare to bring us back to my PowerPoint slides. So what I wanted to do is to just get a sense from you of your sense of the impact of the pandemic. And I think, you know, most of you voting to suggest that there's been a negative impact, I think in very broad terms, you're absolutely right. But as with all things, it's more complicated than that. We can be tempted to kind of give these sweeping generalizations about things like this phenomenon, the impact of the pandemic on young people's mental health. But what the research tells us is it's very nuanced. So, you know, and particularly as you'll see next week, when Ola talks to you about teenagers' experiences of the initial lockdown, it really depends on the young people's circumstances. I wanted to make sure that I could include this gift because I'm a massive Peep Show fan as well. So this was kind of shoehorned in. I hope you'll indulge me on that one. So what I want to do then is to start to think then about, well, if there is a little bit of nuance in this situation, what are some of the factors that might have influenced young people's mental health? So before we look at what the research actually tells us, I want us to think a little bit about how and why the pandemic and the suppression measures, the school closures, the lockdown, social distancing, all the rest of it, how and why the pandemic might have impacted children and young people's mental health. So we're going to go back to Menti in a second. But before we do, what I want to do is to kind of give a caveat. What I'd like to do, I'm going to ask you to contribute ideas in a second about how and why the pandemic may have impacted on young people's mental health. But I want you to think not just about the bad things. Obviously, there's lots of things that we could list that are negative experiences that are associated with the last 30 months. But in what ways might things have improved for some children and young people? Okay, so not just the negative, also the positive. So I will take us back to Menti. if I can. Go. And if I share my screen again. Okay, we should be back on. Can you all see my Chrome screen again? Yeah, okay. So this is a different exercise. This is now going to enable you to have 3 entries, short words and phrases, anything that comes to mind when you think about how the pandemic has impacted, or how and why, sorry, the pandemic might have impacted on young people's mental health. And again, the code for that now is 22 78 95 2. Anything that comes to mind. Okay, wonderful. So the word cloud that's been generated there, if you're not familiar with word clouds, I'm sure most of you are, but just in case you're not, the larger the word, the more it's been used by you as an audience. So loneliness, uncertainty, isolation are the kind of the ideas that have sprung to mind most in terms of your characterization of how and why the pandemic may have impacted young people. But it's really good to see that also some recognition there of some of the positive elements of what's happened over the last 30 months. So young people may have felt less academic pressure. They may have had more family time. You know, they may have, somebody had put somewhere, but it's disappeared now, more exercise and things like that. So there have been opportunities that have emerged, and digital skills, I think somebody put as well. So there's been opportunities that have emerged alongside the very difficult and kind of isolating and uncertain experiences that young people have faced. So I just wanted to kind of do that as an exercise, just to get us thinking about the fact that this isn't a simple cause and effect relationship. There is nuance to it, it's contextual, and the experiences of young people are not uniform. And that you will see for definite when Ola talks to you next week about the results of the teenagers' experiences of life in lockdown study. So again, thank you for your contributions there. I'm going to unshare and I'm going to go back to my PowerPoint if I can. Share screen. Right, so can you all see my PowerPoint? Before I move on to what the research tells us, I'm going to go onto the chat, and before I forget, just pasted in a link for you. The research on the pandemic and its impacts on mental health, like most of the COVID-19 research, moves at an incredible pace. So I finished preparing for this seminar, getting my slides sorted last week, thought I'm pretty much up to date. And literally this afternoon, the Anna Freud Centre, who we do lots of work with here at the university, lots of shared projects and collaborations, published their most recent update summary of the evidence base. So I'm already slightly out of date with what I'm going to talk to you about over the next few minutes. But the link is there. It's worth kind of bookmarking the Anna Freud Centre's publications page, because they are doing stuff, you know, kind of once a month updates on this area, plus loads of really great resources for schools, and it's all free. All the guidance and stuff that they offer is free for schools to use. So definitely seek out that latest research update, but also seek out all of their resources and so on, and join their Schools in Mind network. Okay, so what do we know? I'm going to talk you through 3 or 4 studies that have looked at how the pandemic has impacted on children and young people. The first one of these is the CoSpace Study. So this is a study out of Oxford, and they had just over 2,500 parents who provided data at the start of lockdown and 1 month later. So this is basically just over a year ago. And they recorded data from those parents on surveys about young people's mental health. For children of primary school age, they saw this big increase, about 35% increase in terms of children's emotional, behavioural and kind of restlessness and inattentive difficulties. By contrast, what they saw was no change in emotional difficulties, but a slight upward trend in behavioural and inattentive difficulties among secondary age children. So immediately we see there is some kind of differences according to age, according to how young people of different ages initially responded to the new lockdown conditions. We also, though, see some of the first signs of the kind of existing inequalities that we see in mental health being kind of brought to bear once more. So lower income households reported consistently higher difficulties, but interestingly, the change over time didn't differ on the basis of income. So it kind of reinforced those inequalities, but it didn't kind of widen the gap, if that makes sense. The most recent update of the CoSpace study, and there's this really nice graphic that I think illustrates just how important it is for us to look at things over time. This shows they've been taking snapshots on a regular basis, and what you can see there in the graphic is in that first lockdown period, the kind of rise, particularly in inattentive difficulties, but also in emotional and behavioural problems during the first lockdown. And then as local restrictions start to end after the lockdown and we get into the summer, those difficulties start to dissipate once more. And then as we head into the new lockdown, they start to rise. And of course, during the autumn, there was lots of kids missing school because of, you know, cases in bubbles and things. So there's lots of change and uncertainty again for children. So what you can see, I think, really nicely there is children and young people's mental health fluctuating as conditions change in their lives in terms of whether they're in school or out of school and the extent of the kind of societal restrictions. So really interesting there. But again, it's not a straightforward things have got definitively worse or better and so on. The second one that I want to focus on is an NIHR study. So this was a study that was actually already ongoing. So this wasn't a kind of a pandemic created study. It was a group of researchers who capitalized on the fact that they'd already collected some data for this project in late 2019. So their baseline effectively was, you know, several months prior to the pandemic. And then the pandemic kind of kicks in, lockdown happens, and they take the opportunity to gather some further data so that they can see the impact. So they had about 1,000 13 to 14-year-olds, so you know, very specific in terms of age group, early adolescents. What they found with their sample was no change in the risk of depression and actually a reduction in the risk of anxiety and an increase in well-being. So for this particular study, what they see is actually some of the positive aspects that you generated in that previous Menti exercise possibly being brought to bear with this sample. Reductions in anxiety and improvements in well-being might be related to things like reductions in school stress, you know, children that potentially were being bullied in school and were no longer being exposed to that, all those kinds of different factors that may have contributed to that. However, again, we see existing mental health inequalities being reflected in the findings. So LGBTQ plus students and those who had a pre-existing health problem or disability had consistently worse mental health throughout this longitudinal study. So again, the change over time didn't vary. So it wasn't like the gap was widening, it was just being reinforced. Okay. Final one that I want to focus on is the NHS Digital Study. The reason I've left this one to last is of all of the studies that are ongoing, and there are numerous of them, and I'm only focusing, by the way, on the ones that are in the UK. There's hundreds of studies across the world. I wanted to focus on studies in the UK. This is the NHS Digital Study, and the reason I've left this one to last is because, for those colleagues that don't know, the NHS Digital research group actually do the kind of national audit of children and young people's mental health. So about 3 years ago now, they published the latest update in terms of the prevalence of mental health difficulties among children and young people across the nation. And then this is a kind of a follow-up that came as a result of the pandemic. So it's about 3,500 children and young people who provided data in 2017 as part of the normal kind of national prevalence audit. And then again, in the middle of the summer of last year. So one other thing I want to draw your attention to in terms of making sense of all of this is the timing really matters. So as you saw with the CoSpace study, it goes like that over time because of the various restrictions changing. But also when we compare studies and say, well, why did they find an increase and where did they find a decrease? The timings don't line up for any of these studies. So data in 2017, data in 2020. In 2017, the national prevalence of significant mental health difficulties, which is another key thing for us to think about. This is about, where you draw the line in terms of whether the kind of experiences of distress a young person is subject to whether they kind of qualify as being significant or not. So this is done based on really rigorous assessment, and it's basically, when they talk about significant mental health difficulties, it's children and young people whose mental health difficulties are severe and deeply embedded enough that they would warrant external specialist professional support. So 1 in 9 in 2017, so still quite a large proportion, about 3 children in a class of 27 experienced significant mental health difficulties, whether those were internalizing things like anxiety and depression, externalizing things like behavioral and conduct problems. What they found by summer 2020 was that grew to 1 in 6, so it went up to about 16%. So we've got this significant increase in prevalence. And what they did, interestingly, in the NHS Digital Study was look at what some of the correlates of mental health difficulties were in that 2020 data sweep. And as you can probably imagine, a lot of the correlates over and above the normal, the kind of usual suspects, were things related to difficulties as a result of the pandemic. So witnessing arguments among adults in the household. Well, I mean, that can happen at any time, right? But I think we'd all agree it's probably an increased risk in the last 14 months. Sleep problems, again, many more sleep problems resulting from the pandemic. Lower levels of support, or perceived lower levels of support, from school and college. Living in a household that had fallen behind on payments, and more generally reporting that lockdown had made life worse. So you can see there, in a context where several of these factors are in place, how it can impact on young people's mental health. And those who were previously experiencing kind of mild distress but were coping might be tipped over into that category where they really need some quite intensive support. Other things then, before I move us on to what we might do about all of this. First of all, some other inequalities. Children and young people with developmental disabilities, things like ADHD and autistic spectrum conditions, have reported worse mental health outcomes during the pandemic than their neurotypical peers. We also know, in terms of ethnicity, from a study from the Children's Commissioner in Wales that looked at primary age children, that those from, and I apologise, I know that the BAME kind of acronym is no longer favoured, but I'm just reflecting the language that's used in the report. But those young people from Black, Asian and minority ethnic backgrounds were less likely to say that they felt happy most of the time or safe most of the time compared to those identifying as white Welsh or white British. So again, just coming back to that idea of inequalities being reinforced, we've got evidence of inequalities in relation to income, inequalities in relation to special educational needs and disabilities, in relation to ethnicity, so and to sexual preference as well. So the inequalities we kind of already knew about have been kind of reinforced through the pandemic. And this is summed up really nicely. My colleague David Gregson has talked about what COVID-19 has done. He talks about, as the tide has gone out, it's exposed the pebbles that we already knew existed. So we already knew that there were inequalities in relation to mental health in terms of most of those characteristics to do with ethnicity and disability and so on, and income, and what COVID has done has kind of brought those into really sharp focus. So what can schools and colleges do about this? I'm going to talk in very general terms because, as I said, Alice in 2 weeks is going to talk you through, I think, a more focused approach in terms of the whole school strategy that's been pioneered in Salford in the Emotional Friendly Schools Initiative. But I want to break it down really into kind of 4 key areas. The first of these, and it's going to, just to kind of give you the advanced warning, it's going to spell out a really nice acronym. Okay, so prepare yourselves. This took me most of the presentation to prepare. So the first thing is about the environment. So what schools can do is provide an environment in which children and young people feel happy and safe. And that's all the more important when their home environments and the other contexts in which they find themselves do not do that for them. So school can be a haven for children and young people. And really importantly, you know, if we think about what, you know, beyond the kind of basic job of education, what does school provide for children and young people, particularly for those whose home lives are difficult, challenging, and sometimes chaotic? School provides structure, it provides safety, it provides predictability, it provides routine, it provides children and young people with opportunities to connect with one another and opportunities to play. And those are kind of fundamental building blocks of development. That's why I think a lot of the evidence around deterioration of mental health over the course of the pandemic, it's those basic kind of experiences that are so fundamental for development. You know, children and young people being denied the opportunity to be playing with one another, and teenagers not being able to kind of connect with one another in the way that they typically would. So school can provide an environment in which that can take place, in which children and young people feel safe and they feel happy, so they can be nurtured. School can also be a place where mental health difficulties can be identified, assessed, and monitored. And I'm going to talk in a little bit more detail about that in the next slide, because that's something that our new project looks at. But school is a place where we can identify difficulties, we can identify also areas of strength, and it's also the place in which we can kind of intervene. So we can provide a nurturing environment, but we can also identify, assess, and monitor. And I would argue school is the best place. If you're thinking about, well, where can we best identify early and intervene early, it's got to be school for my money. It's not solely the job of schools, but schools are absolutely central to this process. Schools, though, can also provide support. So there's lots of universal work that schools can do, but also some targeted work for children that need more than that kind of whole school universal layer of provision. There's targeted support, and there's good evidence to suggest that actually the adults that work in the school building, whether it's the teachers, the teaching assistants, learning mentors, they can actually be just as effective in providing targeted support for young people's mental health. Sometimes we do need external professional support, and I'll come to that in a second, but actually, you know, a lot of the kind of job of being an adult supporting children in school, whether you're a teacher or a teaching assistant, you know, you're providing emotional support, you're kind of socializing children's emotional development. And my experience of talking to teachers and other education professionals is actually sometimes what they intuitively believe to be the right thing to do to support a young person. Usually that would be backed up by the evidence. It's just that confidence. So it's that kind of lacking confidence that, oh, well, because I'm not a trained mental health professional, this isn't something that I should be kind of touching. But actually, most of the time, what teachers would suggest is, well, this is what I would do if a young person was anxious or distressed. Usually that's right on the money with what the evidence would say. And then the final thing is to refer. So there do come times when children and young people's mental health difficulties become so deeply embedded and so severe that actually we do need to kind of bring in external professional support, whether that's referrals through to CAMS or to other agencies beyond the school that might be able to help provide support of a more specialist and intensive nature. What you'll hopefully now see is that this is a really nice acronym, which I'm calling RISE. So it's about how schools and colleges can kind of rise to the challenge that the COVID-19 pandemic has created. Okay, what I want to finish with then is to just talk a little bit about the Greater Manchester Young People's Wellbeing Programme, partly because it hopefully brings together a lot of what I've just said, but also because it's very much a local initiative, as you can tell by the title, and so it's fitting for this seminar. So the premise of this programme, which we're in the process of launching, is that young people's wellbeing has to be central to the recovery process. So there's lots of discussion at the policy level at the moment about the recovery process and about how we can build back better and fairer and so on. And young people's wellbeing has to be absolutely central to that. One of the things that I've observed over the last 13 or 14 months is that young people's voices have been absolutely, pushed out of the picture. There's been barely a moment where actually young people have been consulted about the things that are going on. I mean, beyond the kinds of studies that I've talked about and that Ola and Alice will talk about, but in terms of the policy level, young people really haven't been in the picture at all, and that's a tragedy. So young people's wellbeing needs to be absolutely central to this process, and young people's voices need to be absolutely central. So in this programme, we are working with the combined authority and we're working with the 10 constituent local authorities, and hopefully as many of the somewhere in the region of 270 secondary schools, which really surprised me how many secondary schools there are in Greater Manchester. But if you include all the independent schools, all the PRUs and special schools and so on, nearly 270 of them, the university, and a growing coalition of local and national actors. So for example, Place to Be, a whole host of other organisations are working together to make sure that young people's wellbeing is everybody's business, because that's one of the kind of key tenets of this programme, is that this is not just the job of schools. What we need is a coalition of actors who can work together to support young people's wellbeing. Builds on the foundations provided by the Head Start programme, which is something that we've worked on with the National Lottery Community Fund, and work that was already going on in the combined authority. So if you're from a secondary school in the combined authority, you'll be familiar already with the Life Readiness Survey that the combined authority have been working with for the last 3 or 4 years. So it integrates that. And the kind of central backbone of it is an approach to assessment and monitoring of young people's wellbeing over the next several years, to focus and inspire efforts to improve their wellbeing. So basically, this is about making good use of data in the way that schools and other agencies already make really good use of data on academic attainment and other kind of measurable outcomes. What we don't currently do enough of, I don't think, is use data on young people's wellbeing and their mental health and the factors that influence their mental health to help us target scarce resources. We're never going to have enough resources to do everything that we would want to do. So what we need is good quality data to tell us where we should be best pitching those resources when things are stretched. So we do an annual survey of young people's wellbeing and the factors that influence their wellbeing. This is going to develop for us a really rich longitudinal evidence base. We provide feedback. We have a feedback system that we've developed in the Head Start project with an interactive data dashboard that schools can access so that they can identify particular groups within the school population where there are areas of strength and need, and they can work with external support which is going to be provided by the Child Outcomes Research Consortium to help them think through that data, to help them think through how to use the data to kind of inform their provision and evaluate the success of their efforts. We're building communities of practice, so there's lots of great work already in the combined authority in terms of communities of practice of schools working with one another to kind of share and solve problems with one another and with allied professionals. And then also finally, we're working on a system to output neighbourhood data so that we can take a kind of a place-based approach so that we can think about where best, as I said, to target resources. So we've got, for example, arts and cultural organisations, youth clubs, sport clubs, businesses, charities, and other actors who are in and around the city region and are there ready to provide support. But what we need to be able to do is work out, well, where do we need that support? Where can we best place it? So we're working on a kind of place-based approach at the moment that's going to enable us to do that. And what's particularly exciting about that place-based approach for me, because this is all the kind of geographical approach is very new to me, is the extent to which there is brilliant place-based data on factors that young people have told us already influence their well-being. So young people in our consultation process, which I'll talk about in a second, have talked about things like the availability of parks and green space and kind of places where they can spend time productively. And there's brilliant place-based data already in the UK. You know, you can put your postcode in and there's a Friends of the Earth green space rating scale. So we can use that data to help to think about what are some of the things that we might need to address as we build back fairer and build back better. The long-term aspiration of all this is to trigger a step change. So we're at a transformative moment, I think, in education. We've been working towards a kind of a direction where we know that the role of schools in terms of supporting mental health has been increasing. And what COVID has done has essentially made us accelerate our efforts. So we're at this transformative moment. We're at this crossroads, I think, and I think it's an opportunity for the combined authority for Greater Manchester to lead the way in rebalancing our focus. At the moment, educational outcomes are kind of the be-all and end-all, not at the level of the school. I think schools, you know, intuitively recognise that it's not all about academic attainment, but I think at the policy level, there's still a lot of work to be done in terms of national policy around the kind of equity and parity between well-being and academic attainment. And this kind of work, I think, can help us move towards that. Final thing I want to say about this project is the role of young people's views. So young people's views are at the heart of absolutely everything that we're doing. And to date, we've engaged with, as of today, in fact, because one of our project officers was with a school today, we've engaged already with 80 young people since the start of the project at the beginning of the year, gathering their views through workshops and other means to help us shape what we do over the next 3 years. One of those initial tasks was young people telling us what well-being actually means to them. We don't want to impose an adult kind of top-down view. Well, this is what the academic literature tells us well-being is, so that's what we're going to assess. So we started with the views of young people. What young people have said to us boils down to a few things. One is a sense of meaning, purpose, and control in their lives. So what's really important to the young people that we've spoken to already is that they feel that their lives have meaning, have purpose, and particularly that idea of control, of autonomy, that the things that they do matter and that they have agency. What they've also told us well-being means to them is this notion of understanding yourself. So things like their ability to reflect on their achievements and their kind of sense of self-esteem and psychological well-being, but also understanding how they deal with stress, how they cope with difficult situations, and their ability to kind of regulate and manage their feelings. They've also talked to us about the importance of their emotional experiences. And this isn't just negative emotions. It's not just feelings of sadness and worry and anxiety. It's also feelings of joy and hope and optimism. And then finally, and absolutely crucially, what they've told us is that well-being is about relationships. So they talk about their relationships with their friends, which you would expect. So all the young people we've spoken to, by the way, are kind of teenagers, from early adolescence all the way up to early adulthood. And the importance of relationships, that kind of connectedness with their friends and with their peers, but also they talk about their connections within their family, and they talk about connections and relationships with adults in school as well. But what's really crucial is that need and that sense of connectedness that's so vital and that they consider to be a fundamental part of their well-being. Okay, I'm going to finish there, which gives us hopefully about a quarter of an hour for questions and discussion. But what I wanted to end on is a kind of, I suppose, a conclusion that's about the importance of hope. So this has been a very, very difficult 13 or 14 months. And I think one of the things that kind of differentiates us a little bit, you know, in terms of, you know, most of us as adults will kind of think, well, you know, we kind of know, well, at some point this is all going to be over. But actually, if you're a 4-year-old or a 7-year-old, your life, you know, it's sometimes difficult to think about what might happen in the future. It's all about the here and now. And so it's really important to kind of instill that message with children and young people that this is going to end. The scars of COVID are going to last for some time, but actually every day now things are getting better in lots of different ways. So this too will pass. I found this phrase online, which I think sums things up really nicely. This too will pass. It might pass like a kidney stone, but it will pass. With that, I will finish and be happy to now hand back over to Claire to talk through any questions that people have. Thank you.
Oh, thank you, Neil. That was so fascinating. Speaking as someone outside, who doesn't work within children and young people's mental health and wellbeing, it was really interesting and illuminating. And it was nice to end on hope, wasn't it? And I think actually what struck me, throughout your presentation was this sense of hope that it isn't all negative. I mean, there is, obviously there is, data there that is concerning, but it is a more nuanced picture than perhaps I realized.
Yeah, I think absolutely, and I think that's a really nice summary. It's been different depending on young people's circumstances, and there are some things that actually have improved aspects of young people's lives and indeed our own lives, although it's obviously been very difficult, and we have to balance that. We have to acknowledge that things have been very difficult, but also acknowledge that it's not all been bad. Absolutely.
Yeah, I think that was really came across quite strongly. I'm going to go to Pam, who's got a hand straight up.
Hey Pam.
Hi, you knew I'd ask a question, didn't you?
I did.
No, I loved that, Neil. Thank you ever so much. And I thought your summary of the research was great. And I think, because I know that quite a lot of people in the room are not researchers or not people who are working in the mental health sector specifically. So I just wanted to raise the fact that actually we see that those people with already, who already had vulnerabilities seem to be the ones that are coming out worse. So it is highlighting those inequalities. And I just wanted to kind of let people know that we're seeing exactly the same in the adult literature as well. Yeah. So it's not affecting everyone equally. It seems to be really affecting those who are already in vulnerable situations. And again, I suppose because I'm coming from that developmental psychology perspective, what I think is interesting is the same kind of things seem to be influencing outcome across the lifespan. It's the same stuff. It is that inequality. It is that vulnerability. But no, wonderful presentation. I really liked it. So thank you very much.
Thank you. That's really nice. Thank you, Pam. I'll pay you later.
Okay.
We do have a question in the chat, actually, Neil, from Stephanie Cahill. Stephanie says, what are your thoughts on the new one-off government recovery premium for schools? The advice is for schools to use the premium as they see best, but it seems that how schools will actually use it in relation to pupil well-being will have no central guidance, and an opportunity for early intervention in schools may be missed.
Okay, thank you. That's a really nice question. So I think two things on that. One is trying to stay neutral. The idea of a one-off premium, like here we go, we can just dump some money into the system and then go, right, you take care of it, schools. I think that's quite a telling kind of process that the government's taking, because I think it tells you they don't know necessarily what the best thing to do is, and so they kind of say, right, over to you, schools. That said, if there is additional resource that comes to schools and that schools have the kind of freedom and autonomy to use as they see fit, there are some opportunities that come with that. But I think the question about the guidance is really well made, that, there are, if it is just going to be a one-off premium, then you've got to kind of put it on your best bet, don't you? You have to be able to go, right, well, what's going to have the kind of best bang for our buck, and how do we know? And so I think this is where some of the resources that, again, are already available, but quite often are just kind of hidden away from schools, might be useful. So things like the Early Intervention Foundation's guidebook, for example, that has some really great advice, particularly around approaches that schools might adopt and the evidence base around them. So that's a really good resource. There's also, I mentioned the Anna Freud Centre, the evidence-based practice unit there. They've got some great resources. There's also actually lots of resource that's not about programs or packages per se, but just about kind of strategies and things. So the Royal Foundation, the Duchess of Cambridge's Royal Foundation Mentally Healthy Schools, has a load of resources on there, I think now for both primary and secondary schools. I think it was initially just for primary and it's now for secondary. I've mentioned the Anna Freud Centre already. There's lots of information out there already that schools can, that can help you kind of sort the wheat from the chaff. The other thing I'd mention as well, and I think it's still active, is making use of what's available locally. I was involved a couple of years ago in the Schools Link pilot that came out of the Future in Mind initiative, and we were doing training workshops with schools and kind of health professionals about bringing them together to support young people's mental health. And when we asked people about resources that were available locally, quite often they didn't know what was on their doorstep. So the Youth Wellbeing Directory, which is something that the Anna Freud Centre had developed, if you think of the yellow pages, if you're old enough to remember the yellow pages, it's the yellow pages but for mental health. So you can put the postcode of your school in and it will tell you about organisations. Some of them are voluntary community sector and so on, but they're within, kind of within spitting distance, if you like, of your school. And then things like MindEd as well, which again is a fantastic resource designed for busy professionals. But whenever I do a seminar and I say, who's heard of MindEd? About 3 hands go up, and it's just brilliant. So there's lots of resource out there, but actually not all of it costs money. And so, we can kind of use the financial resource that comes from the government for the stuff that does cost money, but then also look at the great stuff that's available at little or no cost. Oh, one other thing, sorry, it's just popped into my head, mental health support teams as well. So some of the schools, not all of them, but some of the schools in Greater Manchester are part of the Pathfinder for the mental health support teams that came out of the Green Paper. And I think they're going to have an absolutely crucial role to play. We have to be realistic, though, in terms of capacity. I was at a seminar a couple of weeks ago when somebody said, well, we should just have this for every school in Greater Manchester, but there isn't the workforce. This is the problem. We can't kind of magic up a mental health support team practitioner for every school, for 270 secondary schools, let alone the primary schools. There isn't the capacity within the system, but what we can do is work within the capacity that we've got and then use the evidence it generates to build the workforce with funding from government and other sources. But mental health support teams as part of the Pathfinders are absolutely crucial as well.
Brilliant, thank you. Stephanie, did that answer your question? I'm sure it did. It was very, very detailed. I also was interested that you talked really about that, that we're at this transformative moment in education, and in lots of ways and in lots of sectors, but in education particularly. And obviously you talked about, your Greater Manchester Wellbeing programme and how that will be co-produced with young people, and that, the whole raft of sort of place-based working that will go on alongside sort of data tracking. And I wanted to put it out, open it up to the floor really. We're at this moment, this fascinating moment where we can take stock, hopefully, of what has happened and move forward. What do you, who are working with young people and children day in, day out and supporting their mental health and well-being, what would you like to see in your schools, your youth organisations? But feel free to put it in the chat or to unmute.
For me, to be quite honest, what I'd like to see is some more help for parents to help their young children with the mental health issues, because I think parents have forgotten how to talk to them about things like that, because there's such a lot of grey areas. And we've talked so much about doing some parenting skills and getting parents and community members a little more aware of how to broach the subjects and checking in properly. We have a lot of parents who just say, I don't know what to say. It's so,
That's a really important point, so I completely agree. And I think I'm going to sound like I'm on commission for MindEd. I'm honestly not, but MindEd has a brilliant parent and family section as well. So, I mean, it's not the only resource, but it's one that I know. And it's, if you've got parents, because I think the issue with parents not feeling that they know what to say or how to say it is one that comes up quite a lot. And I think it's partly still, it's this stigma around mental health that we have. And even though things have improved significantly over the last 10 or 15 years, I think there is still that kind of general stigma around this is a taboo, and particularly in relation to children and young people. So we need to work to to break that taboo down and to break that stigma. But the resources that are on MindEd and other online resources of a similar nature can actually help parents to think through, well, how do I talk to my child about these kinds of issues? Because again, it's the kind of influence of parents. This is not just the job of schools. It's not just the job of parents. It's everybody's business. And the more that we talk about it, the more that we can kind of reduce the stigma around mental health. But particularly, I agree, parents are crucial in this.
Yeah, thank you, Sue. And actually in the chat, we've got another comment which says parents, teachers and members of staff too, they're scared to open the can of worms. And it is really complex, isn't it? As you know, as a classroom teacher, managing all of the different, spinning all the plates that you have to spill, it can be very daunting to have those conversations, can't it?
Well, yeah, it can. It's difficult. It's, I'm not pretending for a second that this is easy, but I think we kind of got to grasp the net a little bit, especially, I mean, again, if we're not going to do it now, when are we going to do it, but it's, every day of the week, talking through difficult issues is going to be better than ignoring or suppressing them, so I think, again, it comes down to that issue of confidence. When I've spoken to teachers and other people that work in schools about, even some of our own students at the university that are on our master's programs about, what would they do in this kind of situation? And typically what they would intuitively do is usually what the evidence base would tell them is appropriate. So it's that kind of thing of actually, developing the confidence that their training as a teacher doesn't just train them to teach kids how to read, write and add up. It also trains them to talk to children in ways that are supportive and empathic and so on. So, these are basic skills that support mental health.
So in a sense, there's an element of trust in your gut when you're in that sort of one-to-one.
I think so, but I think also it's important to have, if you think about mental health professionals, so people that are kind of primary mental health workers, counsellors, psychotherapists and so on, they have this process of supervision. So they are always in touch with at least one other colleague to talk through the issues that they've been grappling with their clients. And I think, some of that exists informally already within schools. Teachers talk to other teachers about, something that's happening with a child in their class. It might be worth exploring a kind of a supervision model more formally if these kind of issues in terms of supporting mental health are going to continue, which I think clearly they are, because it's known within the kind of mental health professions that the importance of supervision, but also for the kind of emotional well-being of the staff as well, that actually these are quite difficult issues that teachers and school staff are grappling with. So they need to have that process where they can unload and that they can kind of have somebody to have empathy with them and so on. So that's really important as well, that we learn more from what's done in the mental health professions. What could we bring into the kind of skill set and the process that teachers undergo?
Yeah, and that's a fascinating point. I mean, I know today we are talking about children and young people's mental health and well-being, but in terms of, understanding teachers' mental health and well-being as they've supported these young people and had to pivot from face-to-face into online and back again, is really fascinating and important, actually. I'm aware we're in the final couple of minutes of the session, so I just want to open up. Is there anyone who has a question that you would like to put to Neil? Or any thoughts really, anything that struck you, surprised you perhaps in that presentation? Feel free to unmute or pop it in the chat. But I think for me that idea of transformation was really came out, that it's a mixed picture, but we are at a moment where we can change things and transform the way things have been done before. And I think that is a hopeful, if we can take something positive out of all of this, that is a hopeful place to be, isn't it?
I think so.
Okay, well, thank you so much, Neil, for presenting this first seminar in a series of 3. And just to remind, thank you all for attending. for, you know, engaging in the discussion. Please do remember that we have 2 more seminars in the next 2 weeks. The link is in the chat, so please do come along. If you, Ola will be talking about teenagers' experiences of life in lockdown. Next week, a big qualitative study, absolutely fascinating. And then the week after, Alice Wignall will be talking about whole school approaches to children and young people's mental health and wellbeing. So thank you very much, and have a lovely rest of the evening.
Thanks, everyone.
Thank you.